so we will start with Marie from Le Monde. Marie, can you hear us?
Bonjour, merci de prendre ma question. Donc, ma question porte sur le contentieux qui entoure l'email qui a été envoyé par Taïwan le 31 décembre. Est-ce que vous pouvez préciser l'heure à laquelle cet email a été envoyé et au contraire, à quelle heure l'alerte chinoise vous est parvenue? Et quelle est votre réponse aux accusations taïwanaises d'avoir manqué à votre devoir de vigilance concernant l'envoi de cet email? Merci.
Merci beaucoup, Marie, pour cette question. And so, quick translation of that. Marie is asking about email that has been sent by Taiwanese health officials to WHO on 31st December. So the question was when this email arrived, when we had the first announcement by Chinese authorities of cases of unknown pneumonia, and how do we answer to claims that WHO was not acting on warning from Taiwan. Thank you.
On the 31st of December, information on our epidemic intelligence from open source platform partners, ProMed, was received, indicating a signal of a cluster of pneumonia cases in China. That was from open sources from Wuhan. On the same day, we had a request from health authorities in Taiwan, and the message referred to news sources indicated at least 7 atypical pneumonia cases reported in Wuhan media, that the cases were not believed to be SARS, however, that the samples were still under investigation. The message requested, with great appreciation, if we had relevant information to share, with a thank you in advance for our attention to the matter. There was no reference made in that query to anything other than what had been previously reported in news media, and actually referred to a response from the Wuhan health authorities clarifying and confirming that the cases existed, the cluster existed. And obviously it turned out not to be SARS. So any SARS test done at that time would have been negative, as would have been influenza samples. Clusters of atypical pneumonia are not uncommon. There are millions of cases of atypical pneumonia around the world in any given year. And certainly in the middle of an influenza season, negative influenza tests may also have been found at that time. So from the perspective of the request we received from Taiwan, it was in line with other information that we had received from other sources. And the message through the iOS platform from ProMed actually had a lot more detail in it based on the news media report. And that request was actually sent immediately on the same day to our country office for follow-up with Chinese authorities. And on the 1st of January, we formally requested verification of the event under the IHR, which is a formal process of beyond any informal verification, which requires a response and requires an interaction from the member state. Under the IHR, member states are required to respond within 24 to 48 hours of any request from the WHO for clarification or verification of an event or a signal that we believe may be significant. That process continued, and on the 4th of January, WHO tweeted the existence of the event, and on the 5th of January provided detailed information on our epidemic or our emergencies information site, which is a site for all national focal points around the world. In every member state has a focal point for IHR, usually within the National Health Service, and all would have received a detailed report from WHO giving details on the event, and that would have included an IHR contact point for Taiwan. Taiwan has access to that site, as have other focal points and contact points around the world. On the same day, we would have actually put out our first disease outbreak news, which was a public explanation or a public report on the event, and the process continues after that. So we would obviously like to thank our colleagues in Taiwan for having shared an interesting report for which we were receiving similar reports from other sources. At no point in the process of communication in this email that's been received was there any reference to human-to-human transmission or any other issue. It was purely requesting relevant information and thanking us in advance for our attention to the matter. So I hope that clears up that confusion.
Thank you very much, Dr. Ryan. I hope this answers the question from Marie. Now we will go to Kim. Please, Dr. Hedges.
So I think Mike answered it very well, but I just wanted to summarize. In its email on 31st December, one thing that has to be clear is the first email was not from Taiwan. Many other countries have already were asking for clarification. The first report came from Wuhan, from China itself. So Taiwan was only asking for clarification. And as some people were claiming, Taiwan didn't report any human-to-human transmission. This has to be clear. They were asking for clarification like any other entity who wanted clarification. So we didn't receive the existence of human-to-human transmission from Taiwan on December 31. We have all the documentations, and the email we received from Taiwan is to get more clarification on the issue based on China's report. So the report first came from China. That's number one fact, from Wuhan itself. Second, the email from Taiwan, like other entities, was to ask for clarification, nothing else.
And I may also just add that for those of you who don't know, ProMed has been in existence for more than 20 years, and is actually a US-based listserv that has provided a lot of early information on epidemics going back over decades. We work with them very closely, and we have actually co-developed with ProMed, with GFIN, which is a Canadian public health intelligence network, and many others around the world, the Epidemic Intelligence from Open Sources platform, which is an AI-driven system which allows the automatic detection of these types of reports all over the world. Our system picks up 7,000 signals, and we pick up those 7,000 signals a month from all around the world, and they all require verification and follow-up investigation. Up to 300 of them require investigations specifically by governments, and it's a massive global process of picking up this information from around the world. And actually all of the G7 countries are now implementing EIOS as part of their core public health architecture, and that system would have been live in all G7 countries at the time of these notifications.